Record-breaking numbers for 4 days in a row for COVID-19 cases. The past 4 days, January 5th, 6th, 7th, and 8th, are now 4 of the 5 highest days of COVID-19 cases in Florida since March. Today takes the number 2 spot with 19,530, right behind yesterday with 19,816. And tonight, hundreds of COVID-19 patients are isolated in Southwest Florida hospitals.
Yeah, Lee Health says they have 200 patients. Right now, they're at 97% of staffed operational bed capacity, with 14.2% of those being COVID-19 patients. With more people testing positive, not just across our nation, but across the state, how has COVID-19 treatment changed? WIC News health and medical reporter Veronica Marshall joins us live in the studio. And Veronica, how has it evolved?
We've certainly come a long way. At first, doctors had a hard time even identifying the virus. Forget treating it. Now we have new tools leading to better outcomes for patients, with more on the way.
We saw so many hospitals that were absolutely packed and just, we couldn't even keep up with the number of COVID patients.
The unknowns in the beginning left healthcare providers with an uncertain path forward, high hospitalizations and death rates.
There was just so much that we didn't know about the optimal treatment.
Despite all we've learned throughout 2020, cases are climbing once again. In December, Florida saw its highest number positives, nearly 324,000 cases, the most since July. And January is on track to beat that too. Out of Florida's top 10 highest days of new cases, 9 were in the last 3 weeks. But new treatment options are making a difference.
There's so much more literature and research that's been done that actually shows dexamethasone specifically is one of the most effective treatments.
Add to that list the innovation of antibody cocktails, and researchers aren't done yet.
From one single umbilical cord, you can obtain over 10,000 therapeutic cell doses.
Dr. Camila Ricordi with the University of Miami's School of Medicine uses stem cells from umbilical cords to treat coronavirus patients and calls the results unprecedented.
100% of the subjects of age less than 85-year-old survive at 1 month versus less than 50% in the control group.
While not FDA approved, this treatment has been used on compassionate care patients and helped. Lois?